With Massachusetts, by most assessments, at the center of the national coronavirus storm, Governor Charlie Baker made a major announcement today.
All public and private schools will remain closed through the end of the school year. It's the right thing to do considering the facts on the ground associated with the COVID-19 pandemic. And at this point in time, there is no authoritative guidance or advisories with respect to how to operate schools safely and how to get kids to and from schools safely.
The governor emphasized that remote learning will continue and that the state is expanding a partnership with WGBH to help. We'll get into that a little later with Christina Quinn, who's one of many working parents struggling to find a balance. But back to the reasoning for his decision. More than 41,000 people have tested positive for the virus in the state, and nearly 2,000 people have died from it as of today. As the governor has said, we're still very much in the middle of the surge, but even when that passes, he says, we need to be thoughtful about how we move forward.
I'll be damned if the way this works is we go through this thing, we flatten the curve, we do all the stuff we were supposed to do, and then we create some run up again in the fall because we don't handle the reentry, the reopening in a way that actually works and makes sense and keeps people safe. The last thing we should do is give this insidious and somewhat invisible virus the opportunity to breathe. We've got to do this right, and we've got to respect the virus big time.
So while that's his stance, a handful of states are already moving toward reopening, at least in part, despite the fact that they don't appear to meet the White House guidelines to do so. But for many others, the key is testing. The good news is that Congress did strike a major deal today on a $450 billion package that includes more money for that small business loan plan, hospital funding, and $25 billion for testing. But there's still no concrete federal strategy. And as the president put it,
testing is a local thing.
I'm joined now by Dr. Ashish Jha. He's director of the Harvard Global Health Institute. Doctor, it's great to meet you. Thanks so much for being here. I appreciate it.
Thank you for having me on.
So a typical back and forth on testing goes something like this. A governor says we need much more help from the federal government. The president says the governor is an idiot and that he is sending out millions of whatever the governor wants. I think yesterday was tens of millions of swabs. Who's right here? Is the problem in the White House or is it in state capitals?
Well, it's possible that we have 50 governors who are all failing at their jobs and a federal response that's been terrific. I'm a little skeptical of that view, and it stands to reason that can't actually be what's going on, because right now we have governors competing with each other, going after resources in a way that isn't coordinated because they don't have any choice. And if we had federal coordination, it would make a very big difference.
How would you describe the federal handling of testing so far, the coordination, any aspect of this? How would you characterize it to date?
It's been, so initially I would have described it as a fiasco. And I think certainly February, much of March was that. We had improvements in March and things went from that sort of terrible state to better. But then we've plateaued again. In the last 2-3 weeks, we have been not only under where we need to be, but falling behind every day. So it's a real problem.
I want to talk about where we need to be. My apologies for interrupting you. Regardless of who is right here, let's give Donald Trump his moment here. Your contention has been that unless we triple the amount of testing we're doing, bringing it up to at least 500,000 tests a day, we are courting disaster. Why is that?
Yeah, and by the way, just for perspective, that's about how much Germany is doing on a per capita basis right now. So it's not some crazy number. What you want is you want to be able to go to work with some confidence that if you stop off at the Dunkin' Donuts for a cup of coffee, the person handing you the coffee isn't infected and shedding virus. The person sitting in the cubicle next to you isn't infected, shedding virus. The only way we're going to get there is if we're going to have pretty substantial amount of testing. And we did some calculations to say, well, what's the bare minimum so people will feel comfortable getting back to work, going back to school, going back to getting their coffee at Dunkin'? And it's 500,000 at the minimum if we're going to pull that off.
But I'm assuming the criterion for selecting that number is not just my comfort zone, but your scientific analysis as to what will tamp down the virus. So could you explain it to us in a way that I might be able to understand it?
Yeah. So look, your comfort and actually the science are pretty related in the sense that if the guy at Dunkin' is infected, and I don't mean to pick on Dunkin' Donuts, I love the place, but if that place has got people who are infected or your cubicle, not only is that going to make you uncomfortable, it's going to cause the virus to spread and the infection to grow. So we're talking about what's sort of the minimum we need so that we don't get an explosion of new cases and that we can keep the economy going. And so they're really interrelated, those two ideas.
And by the way, I should say, I've read other experts in your league who have suggested your triple number is low, that it should maybe be 10 times as high. So why can't we, in the wealthiest nation in the world that spends records of amounts of money on healthcare, why can't we reach that threshold?
I think it's just about leadership and management and really at the most senior levels. You know, some states can't do enough testing because they don't have enough swabs. And I always say, I can't believe we've got an economy shut down because we don't have enough swabs. But somebody's got to pay attention, block and tackle these things, really drive the improvements we need. It won't happen on its own. If we wait for the market to fix itself, it's going to take years. We need this in days and weeks, not years.
Has any state, I want to get to in a couple of minutes some of the states that are beginning to reopen, has any state reached the threshold that you believe they need to be at to safely reopen?
Yeah, one of our neighbors, actually, Rhode Island, has really seen an explosion of testing over the last couple of weeks. I think it's great. And I think from a pure testing capacity, they're probably there. More, by the way, would still be better, but they're probably there. They, of course, still have to see a decline in cases and a lot of other things before they're ready to open.
To meet that phase one threshold described by the White House. Speaking of phase one, I want to play for you Dr. Anthony Fauci on Friday and the Admiral, who is essentially the president's testing czar. I think it was yesterday, on whether the U.S. has the testing capacity for phase one of the reopening. Here they are.
For what we need now, we believe that with better communications, we'll be able to make that happen. If these things are done correctly, what I believe they can, we will have and there will be enough tests to allow us to take this country safely through phase one.
We are ready right now to enter phase one, and we are ramping up all our capabilities across the board, not just to achieve what's necessary for phase two, but 2x, 3x, 4x.
Doctor, are people like Dr. Fauci and Dr. Birch, who we have been praising far and wide as truth tellers, are they bending the truth too much to ensure that they don't alienate the boss, or am I being unfair?
You know, they're in a very difficult situation. Both of them, both Debbie Birx and Tony Fauci, are extraordinary scientists and individuals. And I am confident they understand that we need a lot more testing in this country. I have zero doubts about it, actually. And so I understand that they're in a difficult situation and they're trying to communicate both the urgency of ramping up testing, but also not contradict the president, who's been convinced that we have enough.
But when you hear the president, who at least 40+% of the people still trust, and a Dr. Fauci or Birx, who an overwhelming majority trust, basically say we are there, we are okay to get into phase one, that's what breeds even more anxiety from cash-starved families and small businesses about the slowness of reopening, doesn't it?
Yeah, and I think Dr. Fauci's been very careful with his words. So I don't think he said right now the number of tests we're doing is enough. I think he couches it very carefully as if we do these things and if we expand in these ways, I think we can get there. And I appreciate that he's walking a fine, that tight rope to try to both give confidence to people, but at the same time, I know he and at least some folks in the White House are working hard to try to ramp up testing. But I don't know any scientist who I have met, who I've talked to, who believes that the 150,000 a day we're doing right now is nearly enough. Most people actually criticize me for saying 500,000 is going to be too low. We're going to need more. But I don't think anybody I know thinks that we're at enough testing now.
When I asked you a minute ago, is anybody reaching the threshold? You mentioned Rhode Island. Notably, Rhode Island is not one of the states that's begun reopening, like Tennessee and Georgia and even Vermont. In your estimation, since they haven't reached the testing threshold, if they reopen in the way they're describing, what awaits them?
Yeah. So the way to think about this, right, is if you see a decline in your cases and you open, and some states aren't even waiting for a decline in cases, they're just opening. But if you see a decline and you don't have enough testing, what will happen, the simple biology of the virus, is that the number of cases will start rising. And the question is, how are you going to control that? And if you don't have large-scale testing, tracing, isolation, you can't control the virus. The virus is going to grow exponentially. And at some point, weeks down the road, you're going to have a big explosion in cases, and then you're going to have to shut down again. So this is what awaits people who do not have adequate testing, tracing, isolation strategies. They're going to get into trouble, and they're going to end up having to shut down again, and that's what we want to avoid.
Can we move from the need for testing to the reliability of the testing, which I know a lot of people are concerned about? Today we read about this home test that's soon to be available for $119. We woke up this morning to read about this Abbott ID Now, I think is what it's called. That's the one where you get the results in 15 minutes. And the Cleveland Clinic says it tested 4 major tests, including the Abbott one. And the Abbott one had close to a 15% false negative number. So are even the tests that do exist meeting the reliability threshold that you think they need to?
So obviously we would love these tests to be much more reliable, and a 15% negative really is a problem. And so here's the choice, right? We have to have testing. If we don't have testing, we are going to stay shut down. And so that, of course, is also massively costly to people's lives, to their well-being. And so what we're doing is we're hobbling along with imperfect tests. They're better than no testing at all. What we need is a national plan to improve the availability of testing and the quality of testing. This is only going to happen with federal leadership. I don't think 50 states can all figure this out on their own.
Well, I want to talk to you about antibody testing reliability, too. But since you just mentioned what you did, we're never going to get that federal coordination. I mean, $25 billion is approved this afternoon for some funding of testing by the Senate. The assumption is it'll be signed by the president later this week. That doesn't solve this federal coordination problem you're talking about, does it?
No, money is not really the most important issue here. I mean, money is a bit of a problem, but giving money to states is helpful. That doesn't solve the federal coordination problem. You can't have individual states going out there telling manufacturers to make more swabs or get more reagents. You really need the federal government deeply engaged on this.
Can we talk for a minute about these antibody tests? I was really heartened. I'm sure you read about this thing in Santa Clara, in California, where people were tested for antibodies, and somewhere from 60 to 85 times as many people had antibodies present as the number of people who tested positive. And for those people like me who took a while to understand why that mattered, why it matters is because it means the fatality rate is likely much lower if there are a lot more people who have it. That was the good news until I picked up the Sunday New York Times to read in some county in Arizona, the local board of health said the reliability of the antibody tests was somewhere in the 20% range. Is that an aberration, or are they as bad as that Board of Health suggests?
The Arizona one may be a bit worse than the average, but here's the bottom line. The Food and Drug Administration, the FDA, for weeks blocked development of the virus test. And so now they're basically have gone the other extreme, and anybody and their uncle can create an antibody test and easily get FDA approval. I'm exaggerating a little, but not that much. So we now are flooded with antibody tests, dozens and dozens and dozens of them. Some of them are quite good, and some of them are terrible. And here's the problem. If you take a test that has bad reliability and you apply it to a population, you're going to get numbers that are incredibly high and not meaningful. But here's the most dangerous part. They're going to tell people that they have antibodies and may be immune when they aren't. And so people are going to act like they're immune to COVID when they're not, and they're going to get into trouble and they're going to die. So we need to really get quality control under our belts on antibody testing before we start using it widely, and certainly before we tell anybody that they're immune when there's no real scientific evidence right now that they are.
So the coronavirus testing is imperfect. The antibody testing is far worse. We need serious federal coordination to get us out of this mess and to have the adequate level of testing you describe. Where is the hope in this message? I don't mean this facetiously. Really, where is the hope, Doctor?
Yeah, I'm sorry that I feel like I'm kind of the Debbie Downer here. So let me give you some hope. First of all, I think some states really are taking a great leadership role. And I think our state, the Commonwealth, is doing a great job. So Governor Baker, there are a lot of folks in the state who are doing a really good job of ramping up testing, reliability of testing, saying, you know, we can't wait for a federal fix on this. We're going to figure this out on our own. And we've got great organizations doing that. So a lot of states are going to do very well because they are going to ultimately figure it out on their own. But it will mean many states won't, and it's going to be unfortunate for them. I'm also, by the way, very hopeful that we're going to have therapies coming down the pike over the next few weeks, few months that will turn out to be useful and will make the disease less lethal. So there's plenty of areas for hope, but it's going to be a bit of a slog. And doing this 50 states each at a time is much, much worse than if we had a true federal coordinated response.
Do people walk away from you when you approach them at a cocktail party or no?
I'm not going to any cocktail parties, and I hope you're not either. I hope that when we can have cocktail parties, I have more good news to share.
Doctor, I really appreciate your work and your time. Thanks so much for being with me. Thank you.
Thanks so much for having me.
Ashish Jha.